Autistic spectrum disorder is a disorder that affects many of the children and families that I work with. According to the CDC, as many as 1 in 54 children will be diagnosed with autistic spectrum disorder, with boys being 4 times more likely than girls to receive a diagnosis. It's a disorder that doesn't discriminate against race, ethnicity, and socioeconomic status, and it seems to be becoming more and more prevalent. Because it is such a complex disorder, there is still a lot that we don't know about what causes autistic spectrum disorder, but it's thought that there are both genetic factors and environmental factors. Things like parental age, a family history of autistic spectrum disorder, and environmental factors during pregnancy. There's a lot of research being done, and we are continually learning more about what causes autism and which types of interventions work best. Children are often diagnosed between 2 and 4 years of age, and it can be very stressful or overwhelming for some families to receive a diagnosis of autistic spectrum disorder, but research has shown that the earlier we intervene, the better the outcomes. Autistic spectrum disorder ranges from mild to severe and uses a 3-level system for diagnosis, with level 1 being mild, level 2 being moderate, and level 3 being severe. Children at level 1 may not require very much support, but children at level 2 or 3 may require substantial support. No matter what the level of severity, there are 2 key areas that children need to receive a diagnosis for autistic spectrum disorder. These are difficulties with social communication and restrictive or repetitive behaviors or interests. Children with autistic spectrum disorder may have difficulty with eye contact and joint attention. They may have delayed language or not speak at all, and they might have difficulty responding to their name or following simple instructions. They may have a difficult time understanding facial expressions and body language, and they may seem to be less interested in building relationships compared to their peers. They may have to do things a certain way. They might have a difficult time transitioning between activities, and they may have a special interest that can seem more like an obsession at times. They may also have difficulty processing sensory information. A lot of children with autistic spectrum disorder that I work with have a difficult time attending and staying focused during an interaction. Their parents report that they seem like they're off in their own world, and they can be easily distracted by background noises or even their own thoughts. Their attention can bounce rapidly from one thing to the next. One of the tools that I use to help children stay focused and present during our sessions is the Forebrain. Forebrain is a wireless altered auditory feedback device, and when we wear it, we hear our own voice slightly louder in real time thanks to the microphone, the speech filter, and the use of bone conduction. When I first introduced the Forebrain to children with autistic spectrum disorder, I liked to use the parent as a distractor to help occupy their hands while I placed the Forebrain on the child from behind. I could use something like this squishy toy, this sensory little pufferfish, to keep the child's hands busy while I place the Forebrain on their head. Once the Forebrain's on, I either have the volume off or just really low so that the child gets used to the sensation, and then I gradually turn the volume up as the child gets used to wearing the Forebrain. I aim to keep the Forebrain on for about 10 minutes per session or for as long as the child wants to keep it on for. Some of the families that I work with like to invest in a Forebrain to use at home outside of therapy sessions. If you're interested in using Forebrain at home, you could try choosing activities where the child is naturally more vocal and that require a little bit of interaction. Things like singing songs or doing vocal play are great, so are social games or reading books, or even things like table time or schoolwork if your child is at school. You could aim to wear it for about 10 minutes a day or for as long as the child wants to keep it on for. In using Forebrain with children with autistic spectrum disorder, I've seen an improved ability to attend and focus in a session, and an also improved ability to regulate their energy and mood. The great thing about these improvements is that with continued practice and time, they seem to carry over into our sessions even when the child isn't wearing the Forebrain. I've also seen increased vocalizations because some children seem to like how their voice sounds when they wear the Forebrain. Forebrain is not a one-size-fits-all product, but for the children that it works for, it can really make a huge difference, and I love having it as a part of my therapist toolkit when I'm working with kids with autistic spectrum disorder.